Is your baby's bottom red, sore, or uncomfortable? Don't worry. You're not alone, and you can stop diaper rash fast. In this video, I'm sharing simple, doctor-approved steps that actually work to soothe your baby's skin, prevent rashes, and keep them happy and comfortable. Stick around. By the end, you'll know exactly what to do at home to tackle diaper rash before it becomes a bigger problem. Let's start with the basics. What exactly is a diaper rash? A diaper rash is basically a skin irritation that shows up anywhere under your baby's diaper. It can look red, sore, or even a little bumpy, and it's actually very common. So don't panic if your little one develops one. Most diaper rashes are caused by moisture, friction, or irritants. Basically anything that keeps your baby's delicate skin wet or rubbing against the diaper for too long. The good news, most cases are mild and can be treated easily at home. With the right care and simple steps, diaper rashes usually clear up in just a few days, leaving your baby comfortable and happy again. So, if your baby's bottom is a little red or irritated, know that it's normal, treatable, and something you can handle quickly with a few smart steps. And in the next section, we're going to show you exactly how to do that. Now that we know what a diaper rash is, let's talk about what actually causes it, because understanding the cause makes it much easier to prevent and treat. First up is irritation from urine or stool. Baby skin is delicate, and prolonged exposure to moisture can break down the skin's natural barrier, causing redness, soreness, and discomfort. Rashes are especially common after diarrhea or when your baby is on antibiotics, because both can make the skin extra sensitive. Next, let's talk about reactions to the diaper itself. Some babies are sensitive to perfumes, dyes, or certain diaper materials, which can trigger irritation or even mild allergic reactions. That's why choosing the right diaper can make a huge difference. Finally, some diaper area rashes are caused by other skin issues or infections, things that aren't directly related to wearing a diaper. These can make the skin even more sensitive, and sometimes the rash can appear outside the diaper area as well. By understanding these causes, you'll know why the rash appears and what steps to take to protect your baby's skin. And in the next section, we'll cover exactly what to look for so you can spot a rash early and treat it effectively. Now that we understand what causes diaper rash, let's talk about how to recognize it early. The most common symptom is red, painful, or itchy skin in the diaper area. You might notice your baby seems uncomfortable, fussy, or pulls at the diaper more than usual. Sometimes the rash can appear as raised, peeling, or scaly patches, which can be a sign that the skin is irritated for more than a day or two. In more severe cases, you may see yellow, fluid-filled blisters. These are usually a sign of more significant irritation or infection and should be treated carefully. It's also important to note that if the rash is caused by a skin condition or infection rather than just the diaper, it may spread to other parts of the body, not just the diaper area. By spotting these symptoms early, you can treat the rash promptly, help your baby feel more comfortable, and prevent it from getting worse. Next, we'll cover when to treat at home and when it's time to see a doctor, so you'll always know the safest approach for your little one. Alright, now you might be wondering, when is a diaper rash serious enough to call the doctor? The good news is that most diaper rashes are mild and can be treated right at home with simple care. So, don't panic if your baby's bottom is red or irritated. It's very common and usually resolves quickly. However, there are a few important signs that mean it's time to reach out to a healthcare professional. First, If the rash gets worse or doesn't improve after a few days of home treatment, that's a signal that your baby might need extra care or a different treatment approach. Second, if your baby has diarrhea or a fever of 100.4 degrees Fahrenheit, that is 38 degrees Celsius or higher, you should contact your doctor or nurse. These symptoms could indicate an infection or other underlying condition that needs professional attention. Remember, when in doubt, it's always safer to check with a healthcare provider, because getting early advice can prevent the rash from becoming more uncomfortable or complicated. Next, we'll dive into the exact steps you can take at home to treat diaper rash effectively, so your baby can feel comfortable fast. Now let's get to the part every parent wants to know: how to treat diaper rash effectively at home. The first step is to air out the skin. Whenever possible, remove the diaper and let your baby's bottom breathe. Fresh air is one of the simplest ways to speed up healing. Next, check diapers frequently, ideally every 2 to 3 hours, and change them immediately if they're wet. This prevents moisture from irritating the skin further. And of course, always change your baby right after a bowel movement. No exceptions. Cleaning the area properly is also key. Use warm water and a soft cloth to gently clean the skin. If you need soap, choose a mild, unscented version to avoid additional irritation. For peeling or sore skin, a plastic squeeze bottle filled with warm water can be much gentler than rubbing with a cloth. After cleaning, pat the area dry with a soft towel. Don't rub, because friction can worsen the rash. Once the area is clean and dry, it's time to apply a protective ointment or paste. Look for products containing zinc oxide or petrolatum, and apply them at every diaper change. These create a barrier to protect delicate skin from moisture and friction. During this time, it's also best to use disposable diapers instead of cloth diapers, as they're more breathable and help the rash heal faster. Finally, if the rash is severe, persistent, or shows signs of infection, your doctor may prescribe a specific medication to help it heal. Don't hesitate to reach out. Early treatment can prevent discomfort and complications. By following these simple, step-by-step measures, you can help your baby heal quickly and stay comfortable, turning a stressful experience into a manageable one. Now that we've covered how to treat diaper rash, let's talk about prevention. Because the best way to deal with diaper rash is to stop it before it starts. The first and most important step is to change diapers frequently. Keeping your baby's skin dry is key, so aim to check every couple of hours and change as soon as the diaper is wet. Next, clean the diaper area gently. Use warm water and a soft cloth, and if you need soap, choose a mild, unscented one to avoid irritation. After cleaning, always pat the area dry with a soft towel. Never rub, because friction can make the skin more sensitive. If you use baby wipes, make sure they're unscented and alcohol-free. Some wipes can be harsh on delicate skin, so choosing gentle ones helps prevent irritation before it starts. Finally, at every diaper change, apply a protective ointment or paste. Products with zinc oxide or petrolatum create a barrier against moisture and friction, keeping your baby's skin safe and comfortable. By following these simple habits consistently, you can significantly reduce the risk of diaper rash and keep your baby happy, healthy, and rash-free. Alright, that's your complete guide to stopping diaper rash fast and keeping your baby comfortable and happy. If you found these tips helpful, smash that like button. It tells us you want more content like this, and it helps other parents find this video too. Know a parent who's struggling with diaper rash. Share this video widely. Let's help every baby stay rash-free. And don't forget to subscribe and hit the notification bells so you never miss new, simple, doctor-approved tips for baby care and parenting. Now I want to hear from you. What's your biggest diaper rash challenge, and which tip from today are you going to try first? Drop your answers in the comments below. I read every single one, and your experience might help another parent too. Thanks for watching, and here's to happy, healthy babies. I will see you in the next one.